This was a drug scheduling system that organizes drugs by their acceptable medical use and potential for abuse or dependency. Schedule 1 is the most restrictive category and is supposed to be reserved for drugs with no medical value and a high potential for abuse. These include heroin, LSD, ecstasy, magic mushrooms, and yes, marijuana. That's right, because of the drug scheduling system, marijuana, which has no known death overdoses, is on the same level as heroin, which caused over 15,000 deaths in 2016. Talk about false equivalency, right? It's not exactly Coke or Pepsi. Although I've met a couple of cokeheads in my day, and they're nuts, all right? Now, moving on, drugs with schedules 2 through 5 are alleged to have some medical value but differ in ranking depending on their potential for abuse from high to low. So Schedule 2 includes cocaine, methamphetamine, oxycodone, Adderall, Ritalin, and Vicodin. So again, marijuana, which has no known death overdoses, is considered more dangerous than cocaine, which caused over 10,000 deaths in the United States last year. It's considered more dangerous than opioids, which caused over 14,000 deaths in the United States last year. This doesn't even take into account all the fentanyl and other synthetic opioids, which are responsible for over 20,000 overdose deaths last year. Right. But let's move on, okay? Schedule 3 includes Tylenol with codeine, ketamine, anabolic steroids, and testosterone. Now, I had a boyfriend who used to do a ton of ketamine, and he told me about a time that he spent 2 hours trying to get inside a small plastic water bottle. Not like trying to have sex with the water bottle. He thought that he could get his adult man body inside a 17-ounce bottle of water. But no, marijuana, which mostly just makes you want to eat a tub of icing with a giant pretzel rod, which I may or may not have done on the regular in college, that is supposed to be considered more dangerous than all the other drugs. But I digress. Schedule 4 consists of things like Xanax, Valium, and Ambien, you know, the Desperate Housewives stuff. And finally, Schedule 5 is stuff like Robitussin, Lomotil, Modafinil, Lyrica, and Parapectilin, 2 of which are painkillers, 3 of which are diarrhea medicines. So yeah, the drug scheduling system might not make that much sense. But when marijuana's classification comes under review, like the DEA did in 2001 and 2006, they decided to keep its Schedule 1 classification due to insufficient scientific evidence of its medical benefits. But these studies haven't been large enough to meet the threshold the DEA and other federal agencies like the FDA require to prove a drug has medical value through large, controlled, scaled clinical trials. Yet one reason there isn't enough scientific evidence might be, in fact, the drug Schedule 1 status. So let's try to slow this crazy, vicious cycle down. Currently, according to the National Institute on Drug Abuse, the University of Mississippi is the only institution licensed to cultivate marijuana for research. Elizabeth Warren and other Democratic senators even wrote a letter last year calling for the federal government to facilitate medical marijuana research, which the Schedule 1 classification severely hinders. And just think about this, guys. In late 2015, 58% of Americans said that marijuana use should be legal, which is kind of nuts considering as recently as the mid-90s, only about 25% of Americans held the same position. Organizations like the American Medical Association and American Academy of Pediatrics have recognized marijuana's therapeutic uses, and they've called on the DEA to reschedule it. And hey, all of you folks worried about the youths and their reefer madness, just keep in mind that rescheduling marijuana wouldn't necessarily undo prohibition overnight. It would just likely result in increased access for scientific purposes, which could open the door for labs, universities, and medical facilities to start actually testing the pros and cons of cannabis. So no matter how you feel about marijuana legalization, I think we can all at least agree that we should revisit the drug scheduling system. Because Burning Man would be a lot different if people traded out their ecstasy and angel wings for a joint and some flip-flops. Brought to you by the Marijuana Company of America.